Hi, I'm Dr. Michael Abernathy for Bayshore Dental Lab, and I wanted to take just a minute and give you, your assistants, a tip about making temporaries. Now, I hate to admit this, but a lot of times I ended up doing some of the temporaries. But again, whoever does the temporary, there's some tricks to making it really quick and simple and easy. One is we nearly always take an impression before we prep the tooth as a template for our final temporary. And I don't think your assistants actually understand how important this temporary is. If there's not interproximal contact, or there's not occlusal contact, the opposing dentition or the adjacent dentition will move, and your contacts will be tight and your occlusion will be high. If it's too high, you know, you can bruise the tooth, it's hypersensitive, it'll actually extrude out of the socket a little bit. Just kind of like when you bruise your elbow, it swells up, does the same thing. But in making a temporary, let me suggest something. I don't care what materials you use, but we're going to take an impression. Be sure that, let's say we're using a triple bite tray, that you use the same triple bite tray for the temporary impression that we use for the final impression. Now, a lot of you will go out and try to use the cheapest thing for the temporary and a more expensive, you know, more rigid type of impression tray for the others. And that's a huge mistake, because if the assistant is doing her job and she places that tray in there to take the temporary and the patient bites down and they open up and you look through it and you can't see through it, or the very back edge has all the material smeared off of it, it means the patient can't occlude on that tray, and a triple tray is contraindicated. You can't use it there. Or we need to push it back further so you can practice while the patient is not numb. Now, before we take the impression, there's several things that will make her job making a temporary. One is if they will dry the tooth and then take the impression material, put it on the tray, and then put a little bit on your finger and just smear it on the tooth, so it's pushing interproximally on the two teeth and on the occlusion, and then put it in. What you're going to notice is when you look at that impression, you know, compared to one where you just had them bite together, it's going to have a knife edge all the way around that tooth. I mean, it'll be perfect. There won't be any pulls, there won't be any air pockets, there won't be any water on it, nothing. Now, the advantage is that when all things are done and we're making the final temporary, when you place it in there and they bite together, it automatically makes the margins perfect. They don't have to grind off a millimeter of excess material on the outside or the inside. It'll cut the time it takes that temporary to be made to maybe a minute or two. Now, the second thing is the type of carbon paper that you use. If it's over 20 microns, and I would say 90% of the carbon paper out there that you see is over 20 microns, something like AccuFilm is perfect. Too thick of a piece of carbon paper, they bite together, it's going to mark every time you do it until there's no contact at all. And we need contact. We need occlusal contact, we need interproximal contact. It's the perfect carbon paper. And lastly is when you do take the impression, you're going to find that if you use a bite registration material, something like Blue Moose from Park Hill, but if you use something a little heavier body, especially when we're trying to do multiple teeth, you're going to find that it doesn't distort, because you've got the material in there the second time you put it in. It doesn't create a lot of pressure or distort the impression. The impression will hold tight and the margins will be perfect again. So those are just a few tips on making temporaries. I think it'll help your assistants do it, or even you when you do it. Thank you very much.